Have you ever thought about your prostate? Probably not. At least not until you started noticing some unusual symptoms. The problem is that many men ignore warning signs, assuming they're just minor annoyances related to aging. But the truth is, some seemingly harmless symptoms could be early indicators of prostate issues, and recognizing them in time can make the difference between a simple solution and a more serious complication. After the age of 50, the risk of developing prostate-related conditions such as benign prostatic hyperplasia, BPH, prostatitis, or even prostate cancer increases significantly. In the US, prostate cancer is the most common cancer among men, with an estimated 288,000 new cases diagnosed each year, according to the American Cancer Society. This is why every man should be aware of the signs his body is giving him and take action before problems escalate. Some of these symptoms may seem trivial, but when they persist, they could indicate an underlying issue that requires attention. Today, we'll go over 4 symptoms that should never be ignored because they could be red flags for prostate health. Some may seem like minor inconveniences, but if they become frequent, they could be signaling something much more serious. One of the earliest warning signs of prostate issues is difficulty urinating. If you find yourself struggling to start urination, having a weak or interrupted urine stream, or feeling like your bladder isn't emptying completely, you might be experiencing the first signs of an enlarged prostate. Benign prostatic hyperplasia, BPH, is one of the most common conditions in men over 50. As men age, the prostate gland naturally enlarges and can compress the urethra, the tube that carries urine from the bladder out of the body, making it harder to urinate. According to the American Urological Association, about 50% of men over 60 suffer from some form of prostate enlargement, and this number rises to 80% in men over 80. Ignoring this symptom can lead to complications such as urinary tract infections, bladder stones, and even kidney damage due to urine retention. But difficulty urinating isn't the only sign to watch for. There's another symptom that's often overlooked, but can be just as concerning. Do you wake up multiple times during the night to go to the bathroom? If it happens occasionally, it might not be a big deal, but if it's becoming more frequent, your prostate could be the reason. An enlarged prostate puts pressure on the bladder, making you feel the urge to urinate even when your bladder isn't full. This condition is called nocturia, and it's one of the most common signs of an enlarged prostate. A study from Harvard University found that men with prostate issues wake up to urinate an average of 2 to 4 times per night. This doesn't just disrupt sleep, leading to chronic fatigue and difficulty concentrating, but it could also be an early sign of prostatitis or other prostate-related disorders. Many men assume that frequent nighttime urination is just a result of drinking too many fluids before bed. But if this symptom persists even after reducing evening liquid intake, it could be signaling a more significant problem. And if, along with frequent urination, you're experiencing another specific symptom, things could be even more serious. A burning sensation or pain while urinating is often dismissed as a minor irritation, but it can be a major red flag for prostate inflammation, also known as prostatitis. Prostatitis can be bacterial or non-bacterial, and often comes with additional symptoms like pain in the perineal area, between the scrotum and anus, a feeling of pressure or discomfort in the lower abdomen, difficulty urinating accompanied by pain or discomfort. According to the National Institute of Diabetes and Digestive and Kidney Diseases, prostatitis affects about 10 to 15% of men at some point in their lives. It can also present with fever, chills, and muscle pain. If the pain persists and is accompanied by fever, it could indicate a bacterial prostate infection that requires immediate antibiotic treatment. Ignoring this symptom could lead to chronic prostatitis, which is much harder to treat and can significantly impact quality of life. But there's one more symptom that's even more alarming and should never be ignored. Seeing blood in your urine or semen is always a red flag that requires immediate medical attention. While it can sometimes be caused by inflammation or minor trauma, it can also be an early sign of prostate cancer. According to the American Cancer Society, Prostate cancer is the second most diagnosed cancer in men and often presents no symptoms in its early stages. Blood in the urine or semen can result from increased pressure in the prostate's blood vessels or abnormal cell growth. If you also experience persistent pelvic pain, sudden weight loss, or difficulty urinating, it's critical to get checked by a doctor as soon as possible. Now that we've covered the 4 most important symptoms, let's talk about what you can do to protect your prostate and lower your risk of developing problems. If you want to maintain a healthy prostate, here are some scientifically backed strategies. Follow a diet rich in antioxidants, including leafy greens, tomatoes, nuts, and omega-3 rich fish. Reduce alcohol and saturated fat intake, as these can contribute to inflammation. Engage in regular physical activity, particularly exercises that improve circulation in the pelvic area. Drink plenty of water to support urinary tract health. Get regular prostate checkups, especially after the age of 50, to monitor any changes early. Taking care of your prostate isn't just about avoiding discomfort. It's about maintaining long-term health and quality of life. Many men neglect their prostate health until problems become serious. But paying attention to the warning signs can prevent complications and improve overall well-being. If you've noticed difficulty urinating, frequent nighttime urination, burning or pain while urinating, or blood in your urine or semen, don't wait. Consult a doctor for a professional evaluation. Now, I want to hear from you. Have you ever experienced any of these symptoms? Have you had a prostate checkup recently? Leave a comment and share your experience.